is some business around it, right?
Hi, it's so nice to meet you.
Nice to meet you. I'm John.
Yes. I just wanted to talk to you a minute. I hear you talking about universal healthcare a lot, which I think is really great.
Yes.
The one thing that concerns me is I've heard you a lot in your speeches, and, some of the viral clips and things say some things about Medicare for all that I think aren't exactly accurate. I know in my case, I have like a premium top tier plan. My employer fully pays for it. I have no deductible, and I'm so excited to give up that plan for Medicare for all. And when I hear you trying to kind of get crowds cheering about saving private insurance, what you're really saying is we're going to continue to put profits over people, and no one actually wants that. And I think what your goal really is universal health care, that kind of rhetoric, even if you're not for Medicare for all, hurts the fight overall for universal health care. People don't want to save, people like their providers, they don't like their insurance companies.
Yeah.
And even if you have insurance provided by your employer, they can change it at any minute, and they often do to save money, cut rates, you change your job, you lose your job. So I would just ask that you think about the language that you're using around people loving their private insurance, because that's a pretty big myth. And I think that you know that. And, while you were in office, you were, I think the wealthiest Congress member ever. So it's just very hard for someone from your position to talk to people that way about private insurance. And people, say things about your background with big pharma and stuff. And so I
don't have any background.
Just suggest that.
I mean, in some ways, my wife and I are funding our campaign, so I have no ties to any of this stuff. In many ways, I'm the purest of the candidates in this regard because
I think the purest of the candidates would be normally funded by the people, right?
Well, that's what I'm funded. Well, I'm funded by myself. I obviously believe what I'm saying. But think of it this way: if we create a universal federal health care plan that everyone gets for free, which is what I proposed in my Medicare plan, everyone gets basic government health care for free plan. And if we make that plan so good, then people will just leave their private insurance and join it over time. So you don't have to.
When you say things like you try to get the crowd cheering for keeping their private insurance, you're really going against.
We gotta get it on stage too.
I don't think. Listen, Al just did a poll. Over 100 million Americans.
When we saw Fox News members cheer for Bernie Sanders about giving up their private insurance. So.
I just think my plan is a better way to create universal health care, but it's a good debate to have. But the goal should be universal health care. The best way to get there.
Private insurance is dangerous.